Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening and welcome to a brand new episode of Community A to Z. I'm Muhammad Jamjoom, sitting in tonight for your permanent host, Marwa Midhat Mansour, who's just started her vacation. Tonight we have our esteemed guest, Dr. Nasser Aloud, who's been on the show two previous times. Welcome and thank you for being here.
Glad to be here. Thank you.
Dr. Nasser, you're an assistant professor of clinical social work at Imam University and also a family therapist at the Bin Baz Project Phone Family Counseling Center, correct?
Yes.
Yes. And last episode you were here, you were cut off a bit earlier than you'd expected, and you were just starting to get into the topic of couples who are having their first child. So if I could ask you where I think it was about to leave off last time, when couples come to you and ask you what's going to change with the birth of their first child, what's the first thing you tell them?
Well, as I said before, many things changing in the whole life of couples. Actually, people do not expect this, and in our community and in our teaching in school, whatever, we do not learn about that stuff. Unfortunately, you just only know it by the time you get it. So we're speaking about how do you inform yourself and inform others about those topics, and we cover a little bit topic, but the thing that I want to emphasize that the importance of training, of education, of helping those girls and boys, particularly these days, as you know, and we are in summer where about 70% of marriage happens. Mm-hmm. So unfortunately, after 6 months from now, actually from 9 months or 1 year, everybody should expect to have child. Mm-hmm. Unfortunately, we do have some problem with those couples who either call us in the centers or come by themselves, or I meet them individually in the clinic. So usually they have difficulty, they have miscommunication between father and mother of the child, and everybody puts the burden on others. You are responsible, and she also replied that you're responsible. So what I found actually in the research that I surveyed through the internet and through the webs, I found there's two things that really affect the life of those couples. And the main issue is, one is the issue of housekeeping. Usually, in Saudi it's probably different, but as you know, in Western culture, probably only the couples and the children. But the housekeeping is shared by those individuals. Here I don't know if those research should be applied to our community. But the second is very important, is the child care. So usually also here the husband, does not take that responsibility, right, as should be expected. So we cover those topics, and I think those main issues need to be talked about, it need to be discussed openly between those couples.
Is that something that men in this society are more accepting of these days? If they're coming in, first of all, how difficult is it to get people to accept the idea of coming and counseling now in Saudi Arabia? Is that more accepted than it was before? And secondly, is that type of advice something that Saudi men would be comfortable in taking?
That's a very interesting question. Actually, I did cover this in 2 episodes with Dr. Muhammad Al-Alam in a research firm here in Channel 2. And actually, this is my dissertation topic where I was a PhD student in the United States. I surveyed the Arabs and Muslims there, and I found those issue of coming to the family, or actually whatever counseling is, particularly when it comes to emotional and psychological and social problems. Usually this is associated with either being crazy or you're not, affect your reputation in general.
Seems to be a stigma.
Exactly, stigma is everywhere, but right, in Arabic it is more stigmatized than others. But here in Saudi, what I found through the years of practice in the past 2 years, where I do practice in private as well as in non-profit organization, which is the Bin Baz Project, I found people tend to call by the phone because it's anonymous, nobody knows you, and they discuss this openly. Then they find that this is very satisfied with the service that they were provided with. Then they call up and can we have a meeting with the counselors? So they come to the center, and we do open, actually what they call meeting counseling or meeting interview with those couples. And alhamdulillah, we will succeed up to now, but we have some difficulty, which is either the husband side, particularly where usually they refuse, and the difficulty with follow-up appointments. So people comes and we're satisfied, then they go for 6-7 months, then they come up again.
So perhaps the feeling is, and maybe I'm getting this wrong, but perhaps the feeling is that they can come and it can be sort of an immediate cure. Once they come and talk to you once, they don't need to have the follow-up, but then if the problem persists, that they'll come in again. Is that kind of what your experience has been?
Exactly, actually. And we have people
communicate more directly and really open up a bit more, I would imagine.
Exactly. In addition to, as you know,